Ethel is an 80-year-old woman who was admitted for dehydration. The nurse reports that she is not making 30 milliliters per hour of urine, and the physician orders a bolus of 250 milliliters to be infused within 30 minutes. What is the correct drip rate for Ethel's infusion? A. 1000 milliliters per hour. B. 125 milliliters per hour. C. 400 milliliters per hour. D. 500 milliliters per hour. E. 250 milliliters per hour. The answer is D. 500 milliliters per hour. The minimum urine requirement per hour for most adults is 30 milliliters per hour. Based on a low finding, the physician may decide Ethel needs fluid replacement. Prescribed drip rate is 250 milliliters in 30 minutes. So, in 1 hour, the patient will get double volume, 500 milliliters. Which of the following is the preferred location of intramuscular IM injection in infants? A. Biceps brachii. B. Deltoid. C. Vastus lateralis. D. Dorsogluteal region. E. Rectus femoris. The answer is C. Vastus lateralis. The vastus lateralis is the preferred site of injection in infants. Rectus femoris injections may be performed as a second choice. The dorsogluteal site should not be used in infants as the muscle is not developed and there is risk associated with the location of the sciatic nerve. Deltoid injections may be given to older children when the muscle becomes larger. The nurse is preparing to administer an intramuscular IM injection to a 4.8-pound infant. The nurse should position the needle at which angle? A. 90 degrees. B. 60 degrees. C. 30 degrees. D. 45 degrees. E. 15 degrees. The answer is D. 45 degrees. The preferred angle for intramuscular IM injections is 90 degrees. However, very small infants may require that the injection be given at a 45-degree angle. Based on patient condition, it is the nurse's responsibility to assess the needs of the patient and adjust care as appropriate. The injection site varies with the age of your child. The size of the needle depends on the weight of your child and the type of drug they are taking. When injecting, hold the shaft of the syringe in dart fashion. Insert needle directly through the skin at a right angle, 90 degrees angle, into the muscle. Give the injection quickly, and do not pull back on the plunger before injecting as this causes more pain. Discard the needle and syringe in a thick, plastic bottle or sharps container with a lid. Bring it to your local pharmacy for disposal. The new pediatric nurse has just given a suppository to a 5-year-old boy. He has a bowel movement 7 minutes post-administration. Which action should the nurse take next? A. Inform the physician that the child has had a bowel movement. B. Examine the stool for the suppository. C. Give another full dose of the suppository. D. Give an additional half of the prescribed dose. E. Consult pharmacy. The answer is B. Examine the stool for the suppository. First, examine the stool for the suppository. Based on the findings, inform the physician. If the suppository was fully present in the stool, the physician may want to prescribe another dose. If not, he may choose to reorder half of the prescribed dose or none at all. The geriatric nurse is administering nightly medications to a 65-year-old woman with dysphagia. The patient is able to swallow crushed medications with thickened liquids. Which of the following medications should the nurse not crush? A. Potassium chloride. B. Acetaminophen. C. Sertraline hydrochloride. D. Bandoprazole R. E. Multivitamins. The answer is D. Bandoprazole ER. Bandoprazole ER should not be crushed. ER is an abbreviation for extended release. Extended release medications dissolve over a delayed period of time. Crushing the medication results in a faster rate of absorption by body tissues due to disruption of the coating that allows its extended release.